Hi, I'm Jonas Schreyögg. I'm Professor of Healthcare Management at the University of Hamburg and the Scientific Director of the Hamburg Center for Health Economics. I would like to tell you about our work that we are incredibly excited about. It's on the socioeconomic disparities in all-cause mortality and healthcare use during the COVID-19 pandemic in Germany. And the work was published in Health Affairs. It's a joint work of Esra, Eren, Bayindir, Robert Messerle, Tom Stargardt and myself. Across the globe, people with low socioeconomic status have borne a disproportionate burden of the pandemic. We examined the relationship between two socioeconomic factors, education and income, and all-cause mortality and healthcare use to better understand the impact of the pandemic on socioeconomic disparities in Germany, a country with universal healthcare coverage. We studied a wide range of conditions for hospitalizations, including emergency conditions such as AMI, cancer surgeries, elective surgeries such as hip replacement, and ambulatory care-sensitive admissions, such as diabetes and heart failure. We examined how all-cause mortality and hospital utilization deviated from the pre-pandemic trends during the first 2 years by education and income. And we performed all analysis at county level. Before the pandemic, hospital admission rates of the counties with low levels of education were higher than the hospital admission rates of the counties with high levels of education in general. Although all-cause mortality rate increased and hospital use decreased for all counties during the pandemic, we saw that the effect of the pandemic was most pronounced for counties with low education and least pronounced for counties with high education, a result that we actually expected. So the most striking result of our study was that changes in disparities by education and income in all-cause mortality and inpatient utilization during the pandemic were quite limited, except for ambulatory care-sensitive conditions, where it even decreased. So overall, we think that by ensuring access to universal healthcare, the German healthcare system has done a quite good job in mitigating the impact of the pandemic on socioeconomic disparities in all-cause mortality and large segments of inpatient care. Thank you very much.